Hello, everyone. We're so happy you're joining us. Welcome to our Family Learning Center Community Connection Hour as we celebrate our second annual Women's History Month speaker series presented by San Jose Public Library's Family Learning Center coordinators. Sessions are here for you, and they're recorded in compliance with SJPL's privacy guidelines. To help make your privacy, as Mercedes said, we suggest that you turn off your camera, create a screen name. Welcome.
Thank you so much, Victoria. I'd like to thank Dr. Susie Reyes for joining us today. I'll be reading her biography really quickly before she gets started. And so just a little bit of information about Dr. Reyes. Dr. Reyes was born and raised in East San Jose to immigrant parents. Her first language is Spanish and her second language is English. She attended and graduated from Silver Creek High School. She gave birth to her daughter at the age of 19. In a continuous effort to better her life and the life of her daughter, she enrolled in Evergreen Valley College, where she participated in the college's Enlace program, aimed to help Chicanx/Latinx students successfully complete the academic core, English, math, and science, and to guide Chicanx and Latinx students effectively through transfer and occupational courses in a timely manner. Dr. Reyes went on to attend and graduate with her BA in biology from Santa Clara University, where she was also involved in the on-campus Latino community. After applying to numerous medical schools, she was accepted to the University of California, Los Angeles, better known as UCLA. She moved to Los Angeles with her daughter, who was 10 years old at the time. For the first few years of medical school, she and her daughter lived in LA on their own. Dr. Reyes raised her daughter while earning her medical degree. After graduating from school and completing her residency, she and her daughter moved back to San Jose to be closer to family. Dr. Reyes is currently a physician at Santa Clara Valley Medical Center, where she is the only Latina physician who speaks Spanish. She is also a mentor for the Enlace program that she once participated in as a student. She continues to live in San Jose with her husband and younger daughter. She enjoys spending time crafting and being with her new grandson. Thank you so much, Dr. Reyes, for sharing that with us, and we'll let you take it away.
Hi, good afternoon. Thank you for having me. My journey towards becoming a doctor was probably longer than most. For many reasons, there were obstacles and challenges that I had to overcome. So it was a rather long journey, but I think in the end, all of the experiences have made me definitely a better doctor. Had it been an easier road, like Mercedes said, after graduating from undergrad and moving to Los Angeles, my daughter and I were on our own, which was really a frightening experience to some extent. I had actually not lived on my own before that. I hadn't lived outside of San Jose, and those two combined with being on my own with her were difficult. It was it definitely became a balancing, an exercise in balancing and prioritizing and managing time. Luckily, having my daughter there kept me very, very focused, which was a plus. I saw other medical students who, were distracted by a lot of the social aspects of medical school, and I didn't have those distractions at all. So, she and I would get up in the morning, we would get ready, we would go to school. I would drop her off, I'd go to my classes. She would then attend her after school program while I was in a lab or, some other clinical setting. And then I would pick her up and would take her to whatever activity she had. The one thing that I definitely wanted was for her to have as normal a life as any other child. So she did, she played softball. She had violin lessons. She took writing lessons. She did volleyball. So that was definitely challenging. There were many times when I would, we would drive to softball, and she would practice, and I would either sit in the car or sit in the stands and study. So I always had my books with me, and any opportunity to study, I would take it. I often took her with me to events because, being on our own, I had to bring her. So, but I did often take her on events, especially during undergrad. I often had her with me, and she became an active participant in a lot of the things that were going on. Going back a little bit, during undergrad, while I was at Evergreen, I also organized for the farm workers. So that was during the No Grapes campaign. We would set up leafletting stations, outside of the grocery stores. And I didn't realize that as I was beginning, but afterwards I realized that she was really, really good at getting people's attention and standing there and asking them to not buy grapes. So it actually worked in my favor. During med school, when we were in LA, there were a lot of times when there were after school, there were labs in the afternoon, so I would bring her with me. It wasn't unusual to find her in the anatomy lab with me. So when we were dissecting cadavers or, looking at actual, human body parts, she was there. And at the time, found it fascinating. So being a single mom, I did incorporate her into a lot of the aspects of my education. And I think that had probably a significant effect on her appreciation for education, understanding how important it was to be educated. So once, we were in LA by ourselves for about 2 or 3 years. And I think, during those preteen, teenage years, grew really close, but had all of the typical mother-daughter issues. So, that was a, challenging time. When I finished medical school and went on to residency, I was able to stay at the UCLA VA program. And so, stayed connected to the Latino community in Los Angeles. Once finishing residency, we came back. By that time, I'd gotten married. And so my daughter, my husband, and I came back. And I had a baby by that time too. So the 4 of us came back. And the plan had always been to come back to San Jose to, take care of the Latino community. And so what best place to do it than Santa Clara Valley Medical Center? Is the heart of the Latino community as far as healthcare goes here in the area. And that's where I continue today. As Mercedes said, I'm the only Latina native Spanish speaker that's practicing in the hospital at this time. I always get my, I do take the majority of the Spanish speaking patients, which I love. There's a visible look of relief on the faces of the patients when I walk in and I introduce myself in Spanish. There is, you can see that they are automatically more relaxed. about knowing that they're going to be able to explain themselves, and be understood. And so that's something that really, motivates me to continue working, in this community. I've been asked several times by patients that, can they follow up with me in my clinic? And I always have to tell them, I'm sorry, the hospital is my clinic. The only way to see me again is if you get sick. So, but I have had patients who are admitted multiple times for their chronic medical issues, and oftentimes their response is, Dr. Reyes is my doctor, and I do explain to them that that we're all that I'm not exclusively their doctor, but I really do appreciate being able to take care of them and help them, through their healthcare journey. These past 2 years have been really challenging for the Latino community as far as healthcare goes. It's been very difficult knowing that the Latino community, not just here, but throughout the country, has been affected so deeply by the pandemic. Oftentimes, walking into the hospital, looking at the COVID numbers, it hasn't been unusual for 50 to 75% of the hospitalized patients to be patients with Spanish surnames. And it's been really challenging knowing that they don't have to be there. That their hospitalization could have been avoided, especially the really, and then you see the really, really sick ones, and it's been hard, saying, why didn't you just get vaccinated? This could have been avoided. And so many times I've heard them say, I didn't think I needed it, or I didn't have the time. And that's been sad and hard. You try not to get frustrated, but it's been challenging. I'm glad I'm hoping that we're at the tail end of this, and that the numbers have drastically declined, but there are other challenges that are coming up. There are healthcare professionals. The numbers of healthcare professionals have continue to drop. We've just at Valley Medical, we've lost a lot of nurses who decided to retire early. They some of them made that decision surrounding the vaccines. Even nurses who had been practicing for 20, 30 years chose to retire early. So we see a definite shortage of nurses in the hospital, and that's made taking care of the patients much, much more difficult. I think the nurses have a much harder job than the doctors. They're the ones that are right there, with the patient 24/7, during their shifts. And I've seen the pressures on them. Nurses that are experienced have been really traumatized by the pandemic, and some of them do talk about moving on to other careers, or taking early retirements, and that is really worrisome, because the our numbers are dwindling. Healthcare is a difficult career. It's a very rewarding career. I always say it's like the best and the worst career you could think of. You in healthcare, you can go in any direction that you can go in many different directions with healthcare, but it can be very stressful for lots of reasons. The numbers of patients are increasing. Their healthcare issues are becoming more complex. Their acuity, or how sick they are, can be really high. So there are a lot of different challenges that are needing to be met. Interestingly, the number of med school applications in the last year or so, I've heard, has increased. Whether that ends up panning out to more doctors actually entering the medical field, it remains to be seen. But I thought that was an interesting trend. But the number of nurses has continued to decrease. So it'll be interesting to see how we meet that challenge.
Wonderful. Thank you so much, Dr. Reyes, for sharing with us. We have a few questions for you, and I'll go ahead and start off. As a woman of color, what made you want to become a doctor in the first place?
So I think I'd always had a subconscious, or a subconscious draw towards medicine. It was something that I was always kind of fascinated by. I enjoyed the medical shows on TV as a kid, and there was something that always drew me to it. But when I became an adult and had my older daughter, that experience was a difficult experience. I was uneducated. I didn't know my rights as a patient. I felt very marginalized, and my one of my first thoughts was, I don't want other women to have to go through this. I don't want other Latinas to go through this. They're having to deal with doctors that didn't really have, were not culturally competent. So when I first decided to become a doctor, that was one of the biggest motivators. Being able to take care of Latina patients in a compassionate way. Through my education, through medical school, I came to find out that OBGYN was not the type of medicine that I wanted to practice. I was during residency and at the medical school, my time spent in the hospital with medicine patients was the best time. I felt very comfortable in the hospital. I felt very comfortable, with that pace of work. And so ultimately, I decided to become a hospitalist, which just means that I take care of patients in the hospital. From very low acuity, just minor, medical issues that need to be hospitalized, to very, very sick patients, in the ICU. So that was to me the area of medicine that made most sense to me. But it was that desire to provide more compassionate and culturally competent healthcare that sparked it.
Just really quickly, for anyone who doesn't know, can you explain what residency is?
So, to become a doctor, aside from getting your bachelor's degree in, just about anything, you also have to complete a set of requirements to be able to qualify and apply for medical school. Medical school is traditionally 4 years. When you finish medical school, you are considered a doctor, but you can't practice medicine until you complete a residency program. And there are residency programs in many different types of medicine. There are residency programs in radiology, anesthesiology, medicine, surgery, pathology. So after finishing medical school, you go on to a residency program, you complete that, and then you're able to actually practice medicine and see patients. I did a 3-year internal medicine residency program, the UCLA VA program. And once I finished that, during that time, I decided that working mainly in a hospital was the type of medicine that I wanted to practice. So I became a hospitalist. So now my days at work are spent either admitting patients from the emergency room and getting them, upstairs and settled in, and getting their health, their treatment plan started, or seeing patients that have already been admitted, making sure that everything that needs to be taken care of, has been done, and then getting them discharged and sent home.
Great. Thank you so much, Dr. Reyes. We're going to go ahead and open this up for discussion. So if anyone has a question, feel free to either drop it in the chat or unmute yourselves.
Estamos abriendo ahorita para preguntas, o si tienen una pregunta para la doctora Reyes, pueden quitarse de mute o levantar su mano y pueden hacer preguntas acerca de lo que ha presentado.
So I have a couple of questions. First, thank you, Dr. Reyes, for being here with us again this year. I can't believe it's been a year. The time just flies by, right? I have 2 questions. One, about you as a mom, as we're celebrating Women's History Month. So I'll start with that one. As a single mom, what did you tell yourself to push you through? Like you said, you had your daughter at 19. What were you telling yourself? And did you see yourself here? Could you visualize that this would be you one day at 19?
No. At the very beginning, when my older daughter was born, being so young, I couldn't have imagined getting to this point in my life. If I were to go back and talk to my 19-year-old self, I would say, calm down, it's going to be okay. But at the time, it was frightening. It was really, really frightening. But once I wrapped my brain around the fact that that I was going to be doing it on my own, there was a sense of power to that. Knowing that I was going to be doing it on my own, I knew that I couldn't fail. And that was super motivating. I had a child. I was responsible for that child. I wanted to give her the very best life possible, and I was going to die trying if necessary. So, at that point, life became about getting me and her ahead. And so I, did everything necessary. I grew up really, really quickly. Figured out how to advocate for myself. Once I decided to become a doctor, I jumped in both feet, and I was I researched grants and scholarships and programs, and any conference or or workshop that I could find that would help me get into medical school. That's what I geared up for. That's what I did. I remember I went to at the time Stanford used to do a Dia de los Muertos pre-med conference, and I went with a friend, and it was the first time that I learned how to start selling myself. I learned how to, which was really difficult because I'm not really, I'm not easily. It's hard for me to interact sometimes with people, and I learned how to go up to someone I didn't know and introduce myself, and shake their hand and look them in the eye and say, "Hi, I'm Susie Reyes. I'm going to be a doctor. How can you help me? What can you do for me?"
Yes, that's right.
Yeah.
Ooh,
So
nice.
it was really a fast education on learning how to get myself forward, get us forward.
That's awesome. That's beautiful. And my second question is, you were speaking about how, nurses have retired because of the vaccine, forced to retire, what have you. And I have friends too who are nurses and didn't get the vaccine, and some who did and got it. And I sit back and think, okay, is there something they know that I don't know? So can you just speak a little bit about the type of research and or studies or that we can go read about on the vaccine? Or is there very little studies? Like if we wanted to go read about studies, do you know what I'm saying?
So I always recommend the CDC website to look if you want to look for information. The information on the CDC website is based on valid studies. And when I say valid studies, I mean, for a study to be considered significant enough to base medical decisions on, it has to have power. And that power comes from large numbers. I know that a lot of people have touted, studies as being significant enough to make decisions. Many of the studies have been studies with very few participants, which tends to not make them so powerful in the statistical sense. But the CDC, being a scientific organization, that's what they do. They base their decisions off of numbers. So I believe the CDC website is probably the best place. They would also have links to other studies that they feel are, significant. I'm sorry, what was the second part of your question?
No, I was just, it's thinking of, is there something I don't know about the vaccine? Because why some people get it and some don't, you know, especially nurses or doctors who aren't getting it. It makes me kind of scared.
So I think the problem with that is that nurses and doctors are human. You know, we are all vulnerable to the same fears as everybody else. And you know, COVID has been unprecedented. There have been so many, it's been, there's so many things that we didn't know at the beginning that we do know now. That at the very beginning, it was really frightening for everybody. So you know, we're susceptible to all the same fears. I think there hasn't been the best job at rolling out information. You know, I think that definitely could have been done better. I think that unfortunately, it's been chaotic the way that information and guidelines have been rolled out. It seemed to be, you know, and it has. It's been something that's sort of changed on a day-to-day, on a day-to-day basis. But I think a lot of that was because there was information constantly coming in, and the doctors and the scientists at the CDC, you know, they were changing their guidelines based on new information coming out. So I really get why people have had such a hard time with the vaccines, and and feeling assured that it was okay. It's really hard to say, hey, just trust me and get and get the vaccine. That doesn't work for a lot of people. I get that. I think there's also been a little bit of a deterioration in how maybe people's trust of the healthcare, of doctors. I remember, being a child or young adult and going to the doctor, and doctors were someone that you just agreed with.
Yeah.
And now there's been I think a big erosion of trust. And I'm not entirely sure why. I think as healthcare professionals, the vast majority of doctors and nurses are still there to try and help people, and to really do the best they can. But that's made things it difficult for patients to really feel okay with just trusting the doctors and doing and following that advice. But it's I know a lot of people have had a really hard time with how quickly the vaccines came out, and what I think people have not known, or maybe wasn't really pushed, was that the vaccines themselves, the mRNA and the adenovirus vaccines, the technology behind that wasn't new. I believe adenovirus vaccines, I think those are the ones that are, I'm pretty sure those are the ones that are being used for Ebola vaccination. But the technology for both of those types of vaccines has been around for decades. The technology has gotten so good that they've been able to tailor the vaccine, so that they're able to change a small component of it and tailor it to a specific virus. They're using the same substrate, the same base, and they change a piece of it so that now it's geared towards COVID, or it's geared towards influenza, or it's geared towards some other virus. So the vaccines didn't start from scratch.
Yeah, that's a good
Yeah.
point. That's the first time I've ever heard that said. And that makes a whole bunch of sense. Now, yeah, they didn't start from scratch.
No, they didn't start from scratch. They had this technology already. They had and they had been working towards finding applications for it. The other thing that I think a lot of people don't realize is that when vaccines aren't this I call sexy medicine. They don't really generate a lot of money for vaccine companies, for the manufacturers. So when new vaccines are being developed, they're slow. It's like a dinosaur. They're just kind of plodding along, and the companies, there's a lot of paperwork that goes into it, and a lot of waiting for committees to meet. A lot of applications, stuff like that. In this case, a lot of that bureaucracy was sort of cut out.
Yeah.
Instead of waiting for the next time the FDA meets for vaccine approval, which is like once every 6 months or something, they were doing it faster. So a lot of that, like a lot of those waiting periods were cut out. So that shortened the time as well.
Makes sense. Gosh, thank you so much. Appreciate that.
You're welcome.
Do we have any more questions for Dr. Reyes?
Do you have any advice for moms here that have kids that live in the East Side, maybe, that you can tell them, like, regarding pursuing a higher education, becoming a doctor, making their dreams come true? Because a lot of times we feel like, oh, it's not going to happen, or we can't do it. Like, what would you tell the parents here to tell their kids, or what kind of conversations, or what would you suggest?
That's hard. So, as a parent, I think I would tell other parents that if their child wanted to become a doctor, well, first of all, be sure that that's something that the child wants, because healthcare is difficult. But if parents of children on the East Side who children want to become doctors, obviously education is the key, but finding out programs where their children can start to get involved in the medical field. There are volunteer programs, even at there's Valley Medical Center. I forget the name, but there is a volunteer program where they have high school and undergrad students volunteering in the hospital. They are in sometimes even in the emergency room. They have students who are bilingual who are there helping to translate, and it's extremely motivating to have as a student to be in the environment that you're hoping to become a part of. So find which programs are available, and and get your kids into it. Getting help with schoolwork. I know a lot of Latino students can struggle with the schoolwork, and there are a lot of resources out there to help with tutoring, and just really encouraging them to not give up. It can be a long road, probably not as long as my education, but it can be very, very daunting, and helping them to see that eventually at some point you would get to that goal.
Something that stuck with me from our conversations is the story that you shared about your daughter going with you to health clinics or health fairs. Can you tell us a little bit about that and what impact you saw that had on the community?
So, I would drag my daughter around to all the events that I wanted to attend. There was a UCLA student organization, the CMSA, Chicano Medical Student Association, or at least that's what it's called at the time, would hold a yearly health fair in I forget the community, and so it was healthcare screenings. My daughter was there helping out. She learned how to do blood sugar checks. So she was, sitting there with the rest of. So she was sitting there with the medical students, checking people's blood sugars, and there were, other kids there who were attending the health fairs, and or they would ask, well, are you a medical student too? Because she was really, really young. And I think that was, inspiring to some extent, seeing someone young who was also participating. Yeah, and it was fun. It was really fun to be able to share those events with her, and see her, interested in what I was doing. She said that she wanted to become a doctor, but then later she decided not to. But she, I think at least to some extent, she did enjoy being a part of all of that, and it cemented her the importance of education for her.
If you did mention that your journey in school and to become a doctor did take a little longer than some. When we hear you tell your story, it's easy to think of she went to Evergreen, she went to Santa Clara, she went to UCLA, and then she became a doctor. Can you kind of lead us through the maybe the years you were in school, if anything came up that kind of took away from your schooling for a little while, or how long did it take you to become a doctor, to just really get an idea of how much work you went through?
So from beginning to end, it took me 17 years to complete my education. There were a lot of things that went into that. For starters, I was not a very good student in high school. So I essentially had to redo the 4 years of high school when I started college. My first year of school at Evergreen, I took remedial math and the very basic language, English classes. I was able to get through them pretty quickly, but that added probably 2 years to my education. And then life kept happening. I got divorced from my older daughter's father. I lost a semester there. I had some health issues and had to drop a quarter at Santa Clara. Life kept getting in the way of finishing. So in the end, it took a lot longer than one would imagine. But I think that helped form, an appreciation for completing it. Once I was done, it obviously it felt like a major accomplishment, but I knew what I had gone through to get
there. I also remember you mentioning that there was a time that you came back to San Jose for a little while and seriously considered possibly not going back to school. Can you speak to that a little?
So, yeah, so I took a year off during medical school to come back and get through some issues. And at that point, I was really realizing how difficult medical school was and how difficult being a doctor was going to be. I realized how much I was sacrificing and was going to have to continue to sacrifice to complete that. So I decided to see if there was anything else out there that I would prefer doing, rather than, continuing on. I worked as a substitute teacher. I worked, in high-tech companies. And in the end, it still came back to being a doctor. There was nothing else I had ever wanted to do. There was nothing else that I, even now, even now when I am tired or discouraged, I think, well, what else could I do? And it still comes back to medicine. It's still the only thing I'd ever wanted to do. So, yeah.
Thank you so much, Dr. Reyes. Do we have any questions from anyone listening in?
I think what you do, Dr. Reyes, every day is very inspirational. There's a lot of times where we feel like, oh, there's all these like reasons why I can't get to where I need to get or to accomplish my dreams. And you had a lot of obstacles in your life, and you still managed to reach your career goals. So I commend you on that and for setting a good example also for other youth and other people in our community. So thank you for sharing your story with us today and inspiring all of us.
Thank you.
I 100% agree with Ofelia. If we don't have any more questions from our audience, I'm going to say thank you so much to Dr. Reyes for taking the time out of what I can only imagine is a busy schedule to spend time with us here today to help us celebrate Women's History Month. So you may not be remembered in the wider history of the world, but you'll always be remembered in the east side of San Jose and in our community in general. So thank you so much, Dr. Reyes, for joining us today. And thank you everybody else for tuning in today. We really appreciate it. And be sure to join us next week next week we have our disability, a few disability awareness, a disability awareness speakers coming in to share with us. And the following week we will be resuming our Women's History Month speaker series. So be sure to join in both weeks. And the Women's History Month speaker series will culminate on a special session of our Community Connection Hour, which will be the 29th of this month. And it will take place from 5 to 6 p.m. So if anyone is interested in continuing to attend these sessions, please look on our SJPL website for the registration and for more information. So thank you everybody so much for joining us. Again, thank you to Dr. Reyes for being here with us today. And feel free to stick around if you have any other questions. And if not, thank you so much.